For years, Allina just shifted costs to employees. Our healthcare costs kept skyrocketing, and the way they controlled that was through passing that cost on to the employees. And eventually realized that we couldn't continue to do that, that wasn't the approach, that wasn't going to solve the problem, and that what we really needed to do is focus on our employees' health and how to improve their health so we could control those healthcare costs. And that's what we've really started to focus on, as opposed to just controlling costs through cost shifting. How do we improve the health of our population through wellness assessments, health coaching, disease management, case management, e-learning courses, all kinds of different tools and approaches that we've really tried to employ to improve the health of our population. We're really on the front end of figuring out how that healthcare dividend. It's only been about 2 years since we've started to put in place those tactics to improve the health of our population. So I'm hoping that we can really get to a place where we are able to measure the healthcare dividend, where we can show that return on investment, we can show that our programs are working, that the health of our employees has gotten better, that our healthcare costs have either stayed stable or come down even better, that we can see improvements in productivity, and that we can see improvements in engagement, and that the employees actually feel that the organization is investing in their health. And I think we've got a ways to go to get there. I think there's still a lot of work to do, but I hope that over time we can really get that senior leadership and engagement, and get our employees to understand that all the things that we're doing for them, and that they need to be accountable to work with us. To some extent, I think we're being more disciplined because of what's going on in the economy today, about how we determine whether our programs are really providing the value that we anticipated. So I think we're trying to put more concrete measurement in place to make sure that we're getting that return on investment on every single program that we're doing. I don't think the economy right now has changed our strategy, and I think that's what my big goal is to say we've put a strategy in place to really move the health of our population, and I would hate to see the economy impact that strategy and say we're going to back off on that investment in our employees' health, because I think long term that's what we're going to have to do. And if it's kind of that short-term gain for a pain for long-term gain is going to be the really important thing. And so hopefully we can stick with our strategy, keep it in place even through these difficult economic times, but put more rigor and discipline around making sure that the investments that we're making are actually working, and evaluating that on a consistent basis, and also looking for opportunities with our vendors and where can we leverage what they provide us already, and maybe spin that in a little different way to impact our employees' health a little bit more, or get our message out, and get that employee engagement. Our leadership is very focused in this economic environment on how do we reform healthcare for our patient population. And so they're not quite as focused on, they don't necessarily see that complete link back to our employee population, unfortunately. But we're working on it, and I think we're doing some things from a governance standpoint to try to get our senior leaders involved in looking at the metrics, looking at what we're doing with the employees, helping us do those evaluations of the programs, and really understanding how the health of our employees is impacting the productivity and their bottom line. So trying to make that connection for them. And we're getting some traction there. So I think, like I said, we're still kind of in that infancy stage, and if we can continue to just drive that message home, I think we will get that senior leadership engagement, and hopefully they'll see that in order to have happy patients and satisfied patients and good quality and safety within our hospitals, it's imperative that we have healthy employees. Our employee strategy was developed based on what our business strategy was. I mean, that was actually one of the directives that we got from our senior leadership, was link what you're doing with your employees back to what our strategy is as an organization. And our strategy as an organization is actually, our business has been, as a hospital system, very centered on acute patient care. But they recognize that that's not the future of healthcare. The future of healthcare is really keeping people well and dealing with them across the spectrum of life. And so we have actually 4 components to our corporate strategy, which is that prevention, that wellness aspect of it, dealing with people who are chronically ill or need disease management, the acute setting, how do we help people when they're in crisis, healthcare crisis, and then at the end of life stages, so palliative care and hospice care and things like that. So that is the strategy of the organization. So what we've really tried to do from a benefit standpoint and employee wellness standpoint is link that back. So it isn't a huge leap for senior leadership to make. It's merely a matter of getting them to focus on it and understand how they are linked. So it's kind of continuing our messaging around, okay, you want as an organization to move care upstream to prevention and wellness. Let's do it with our employees first.